a bit about that study. So that's my experience with it. As far as my advice to people should take it, I would say take it, but it's a personal choice. It's best if you can consult with your physician, family doctor, that know your medical history, to kind of get the final word from him or her on that. And in my household, some will take it, some won't take it. Some take the flu vaccine every year, some don't take the flu vaccine at all. So I think people need to be very comfortable and check with their primary, doctor, and get the word from him or her. Don't get anything from social media, all those, fake stuff that are put out under the name. Sometimes, unfortunately, some claimed doctors are saying, don't take it, something like this or that will happen. What's going to happen in a year, 2 years afterward? I mean, the study lasts for 2 years. We've been like 4 months into it. And the reason it's going to last for 2 years is to see what else can happen, because this is a relatively new vaccine. Dr. Nabha said maybe it's been there for maybe 10 years. So that's reassuring in a way, this technology used. But if you're comfortable with it, if the doctor says, yeah, you don't have allergies and you're a good candidate for it, by all means, I think you should go out and take it and have your people around you take it. Now, I want to add one thing that, and Dr. Nabha can basically elaborate on it. You should be kind of careful when you take the vaccine, the first injection, which is sort of a primer for the body to say, oh, what's going on? Let's take a look and start developing. I mean, this is an engineer analysis of what might be going on. So the body would develop a way to fight antibodies. And then there comes 4 weeks later for the Moderna vaccine comes the booster injection. And I think what the body does, the symptoms that I felt is that the body now recognized this intrusion, this virus, and acted against it. So the fever and the shivers and all that, which in a way a good sign. So when you take the vaccine after the first injection, you are still exposed. If you get COVID, you might, get hospitalized if you're my age or older, or you have some pre-existing conditions, because the body is not ready for it. And it would take really, I think I read that the effectiveness, it kicks in, this 95% efficacy is really after, like a week after the second injection. And maybe Dr. Nabha can elaborate on that. So that doesn't mean you took the first injection, you go out and about, you still need to put your mask, social distance for a good 4 weeks. And then afterwards, hopefully things will, by then, hopefully end of spring, early summer, will be okay, almost back to normal. Dr. Nabha, what's your thoughts?
I think you're absolutely right. I mean, you hit the nail on the head when you said a lot of people start having those symptoms after that second vaccine. So that first shot primes your immune system, that and gives you some level, but that you really need that second vaccine. And those side effects that people complain about all the time that they feel, that's actually a good thing. That means that your body is working, it's seeing this, it's creating antibodies. When we get sick, when we get a cold and we start getting those aches and those body aches and the fever, that is our body forming antibodies to fight the infection. That's not the infection itself per se. So when you're having those side effects, and majority of people will have some level of side effects, about 10% or so in one study had a fever. It's not a bad thing. You need to call your primary care doctor if you don't feel better within 24 hours. But as you said, exactly, 24 hours later, you should be feeling better. A lot of people get the side effects from the flu. And I do want to say that you cannot get COVID from the vaccine. You cannot get COVID from this vaccine. All they're injecting is a recipe to create a part of a protein of the virus.
Thank you. I think I have some questions for Dr. Hassoun to maybe elaborate more on your experience. One question I think I have from Mazen Youssef and Dr. Rima Sakr. Go ahead.
Hi, Dr. Nabha. My name is Rima. I'm a fourth-year medical student. Thank you so much for taking the time to speak to us this evening. I was hoping that you could speak to the role of the flu vaccine this year. I really have been hearing a lot of anecdotal stories about people not being interested in taking the flu vaccine if they were to go with the COVID vaccine or vice versa. Can you speak to the importance of the flu vaccine, particularly this year?
Absolutely. And congratulations, you're almost your fourth year. So
Thank you.
there's also light at the end of the tunnel for you too.
Absolutely.
So that's an excellent question. Let's talk about the flu for a second. This is so interesting. So with all of these masks and all of the social distancing that we've done, remember the Southern Hemisphere gets the flu before the Northern Hemisphere because of the weather differences. And what they've seen is in Australia, they've barely seen the flu there. So what it's actually done is it has reduced the levels of influenza significantly because of all of the measures that we're taking. So I always recommend getting the flu shot. I think the flu, it is one of the most preventable infections. If you can get the flu shot, people do get side effects of it, but it really reduces your rate of complications. Now, deciding on when to get the flu shot and when to get the COVID-19 vaccine, that's important. You want to separate out these vaccines by at least a few weeks. So you really want to time this with your physician. You can get your flu shot first, and then in 2 weeks at least get your first COVID vaccine. But I would not put the COVID vaccine with the flu shot at the same time. You really don't want your body to go into a hyper-inflammatory, hyperimmune response and essentially put your body in overdrive, creating antibodies. So you want to separate them out by at least a couple of weeks.
I'd like to add that in the study, they advise us not to take the flu vaccine because maybe they don't have all the answers and they don't want things to get conflicted. But they said, okay, 2 weeks after the second injection, you can go ahead and take the flu vaccine, which I did. So that's something.
And you did great. You felt fine, right?
Yeah.
Well, that takes me to a question to Hassan Jabir from Access. You know, I mean, we talked about, Dr. Linda told us about how safe the vaccines are and the process itself and some of the myths about the vaccines. Dr. Hassoun himself, was at the receiving end of a vaccine. What are the roles can be played by organizations such as Access in battling misinformation and in making the vaccine more accessible, if that's something can be done to the local community?
Yeah, thank you, Adnan. First, let me say that Ali Nabha and Saad Madarani did a very good job raising Linda. Congratulations. Let me just say that obviously we do have the major concern now that too many people, roughly around 40% of the population, are saying now that they're not going to be taking the vaccine. And this is a very, very alarming challenge here, because you really, as a population, Dr. Linda knows this, we need to get to 75% vaccinated to be able to start building immunity to this virus. So there is a significant number of people that are indicating that they will not be taking the vaccine. And these people, I have to say that these people are, some are motivated by different reasons. One group of them, by the way, this anti-vaccine is not a new phenomenon. It's been going on for many years now. There is actually a group in Michigan called Michigan for Health Choice, that have been fighting vaccines, children vaccines and other type of vaccines for many years. And they're very strong, organized group of people. They use social media effectively. I'll give you an example. A month ago, when the news about the vaccine was started to emerge, a social media YouTube a video was saying that there will be 1 million of people dying from this vaccine. By the time YouTube removed this video, 8 million people have seen it already. So this group is well organized. They have a very heavy presence in social media. They use information and media effectively, and they've been using it for some time. And it's mostly suburbanite. It's a strange phenomenon because these are mostly educated suburbanite communities. There are other groups with some legitimacy to their concerns, especially African American community. And the reason is that African Americans in the past were used in very unethical way as a testing community to diseases. There is that mistrust of government, which also includes our community. The mistrust, the sense that they are being targeted, the sense that they are not being valued like other communities, the sense that they can be sacrificed. So that's playing also in the African American community and immigrant community. I don't know if some of you know that these immigrant women at the border were subjected to experiment to prevent them from getting pregnant. And that's recent. So there are these issues of mistrust, and these issues, some are legitimate, and we need to work on these issues. And it takes an effort to do that. And the other group is much more organized, much more sophisticated, and they have capacity, and they use policy, and they use social media to their advantage. Finally, for us as Arab American, the language issue is a factor. How do you translate information that are meaningful and accurate to our community? In addition to bringing down that suspicion and that mistrust of government. So we really have work to do. And trusted voices like Dr. Linda, like Dr. Hassoun, are so critical. This is where the conversation should be among us. We have the expertise. We have the intelligence. We have people who are sincere. And we need to have a conversation with our community about what are the science and what are the facts, and see if we could push back. So we need these trusted voices. We need our organizations. We need our religious leaders. We need our scientists. And we're blessed that we have a strong presence in the medical fields. Let's use these voices, these trusted voices, and engage the community.